Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. You may notice a little bit of a different backdrop here. I'm actually on the road in Kansas City, Missouri tonight, and in the room I'm staying, this is the best I could do. Sorry to have the pictures growing out of the top of my head back there, but hopefully this is all going to work fine. I'm also don't have my fancy light set up, my fancy microphone, but I've been able to rig up some good lights here. I think it's going to work out fine. And I hope that my microphone is going to work fine for you for my computer as well, too. So I see this is actually the largest sign up I've had for one of my webinars. I'm glad to see that. And I hope that all of you get some value out of this tonight. I know I've got a number of people that are coming back here again, quite a number of people that are coming back here again. So I think you keep getting value here, and I hope I can keep producing that for you as well, too. For those of you that are new here, there's a couple ways that you can participate in the webinar tonight. One of those is to listen to the questions as I read them, and actually they'll show up on your computer screen in the live version as well too, so you can read them too, and see how I respond. There's always some good learning that takes place that way. Another way to participate is to actually write a question. Go bold on your first time if this is your first time, and write a question. The way you do that is in the chat box on the right-hand side of the screen at the bottom. You can write your question there to me. One of the things I ask is that you don't hit the enter key until the whole question is written. If you should try to hit the enter key before the whole question is written, it actually sends multiple questions to me. Each time you hit the enter key, it sends a question. And for some of the longer questions, it gets really hard for me to piece those parts together from my end. Okay, so please try to write just one long run-on, or actually shorter run-on question for me. That makes it easier for me to follow from my side. Okay, all right. And let's see here. So I am creating a webinar recording tonight. And if everything goes as planned, and it actually is recorded, I'll have that. I'll be editing that up tonight, just a brief edit on that, and then get it loaded up to YouTube. Tomorrow morning, I'll create a written synopsis of what we talked about. And then tomorrow morning, you'll get an email from me announcing that the recording is ready to be seen, and it will include that synopsis as well too. I anticipate having that to you by around 9 to 9:30 Central Standard Time tomorrow, so a little bit earlier than when I host these webinars on the West Coast. So you'll get that a little bit earlier. When you get that, feel free to share it with everyone. Anyone you think is going to get benefit from either knowing about my webinars or the answers that I give in the webinars, share it, send it around. I'm trying to reach as many people as possible, and I'd like you to join me in that quest by sharing my information as well too. So anyhow, so those are so please help me with that as well. All right. So without any further ado, let's go ahead and get started here. Let me put these things on so I can actually read your questions here. Hello, Tim. Let's see. Hi, Dr. Ross. I hope you're doing well and that you had a nice Thanksgiving. I did. Thank you very much. I hope you did too. On the last webinar, you mentioned tetracycline is fine to use as an alternative to doxycycline or minocycline, but that it can be hard to find in pharmacies these days. My question is, when you used to prescribe it, what dosage would you use? You mentioned that it's 3 times a day. Thank you so much. So tetracycline, a dose is 500 milligrams 3 times a day. The comparable dose for doxycycline would be 100 milligrams doxycycline twice a day. And the same thing for minocycline. A comparable dose of minocycline is 100 milligrams 2 times a day. All right. So one of the difficulties with tetracycline, when you use the drug called tetracycline, is that it's a 3-time-a-day medicine. Sometimes it gets to be a bit harder to take medications 3 times a day. All right. Thanks for that question, Tim. Good luck to you. Hello, Colleen. Let's see. Hi, Dr. Ross. I know vegans should ideally be taking carnitine. Do they still need the carnitine if eating 1 egg per day and taking a serving of krill and tilapia oil per day containing 1 gram of krill oil, but no meat or fish other than the fish oil? Does the answer change if they ate a plant-based diet but added the eggs, tilapia, krill, plus 1 serving of salmon per week. Thank you so much for these webinars. They're invaluable. So Colleen, the issue with being vegan and vegetarian, actually, and not eating red meat. Red meat is the issue, all right? And why that's an issue is red meat has a protein in it called carnitine, and carnitine is needed for your mitochondria, which are your energy factories found in every one of your cells. The mitochondria need carnitine to help carry fat and sugar into the inside of the mitochondria. Fat and sugar are the fuel sources for the mitochondria. Inside mitochondria, fat and sugar are burned through a bunch of chemical reactions to create a type of cell fuel called ATP. All right. So, but you got to get the sugar and fat in there. And the carnitine is needed to transport the fat. So if you don't have carnitine in your diet that you get from red meat, okay, not from oil, not from eggs, not from salmon, but from red meat. And red meat sources would be things like lamb, beef, buffalo could be a red meat source as well too, but truly red meats, okay? Those would be the ways that you're going to get carnitine. And my point that I raise in some of my articles in my Treat Lyme site is I have an article on energy and I have an article on how do you fix your mitochondria. And what I say in both of those is if you're a vegetarian or a vegan and you're not getting red meat, and by that I mean lamb, bison, beef, those are your sources of red meat. If you're not getting those, then you may be short in carnitine, and that can lead to problems with the functioning of your mitochondria because they can't get enough fat to the inside because they don't have the transport vehicle to do that, okay? So the source of carnitine that I like to use is a form of carnitine called acetyl L-carnitine because it's pretty well absorbed. Thorne makes a product called Carnitil that has the acetyl L-carnitine in it. And usually what I'll do in somebody that I'm using it, primarily if they're vegetarian or vegan and they have low energy, I'm going to put somebody on that. And I'm going to start it at 500 milligrams, 1 pill twice a day. And then after a month of doing it twice a day, I would then decrease it down to 1 pill 1 time a day. Okay. All right. And so that Thorne product again is called Carnitil. It's CARNITYL. As many of you know, if you're looking for sources for these the supplements that I just discussed tonight, let me just show you how you can do that here real quick. All right, so I think we're doing a screen share. Huh, it doesn't look like it's going to work again. Darn it. All right, so it looks like my, I don't know why. Why are you not screen sharing? Let's see if it'll do it now. Nope, it's not doing it. So there's some reason when I use my laptop, I'm not getting into screen shares here. So anyhow, I guess we won't be doing a screen share tonight. Anyhow, my Lyme disease supplement or my supplement store that carries a number of products that are useful in Lyme disease is called Marty Ross MD Supplements. You can find that at treatlyme.com. You'll see a big navigation menu at the top. It's a tab called Supplements, which if you hit that, it gives you this huge drop-down mega menu. Just look for under the Thorne part there and you'll see it. Or there's a search bar at the top that you can type in Carnitil. Okay, that's CARNITYL. Just so you know, I don't, so the store is what I use for my existing patients, but anyone can purchase from me. And if you're ever wondering, if you read my articles or you hear me mention something tonight, you're thinking, what brand would he recommend for curcumin, for instance? Just go to my store and type in the search bar curcumin, and you'll see the various products that I recommend that carry that as well too. Okay, all right. The reason you might want to do that, look, there's a lot of garbage supplements out there. There's been studies done looking at the quality of supplements that are carried in various stores. And a lot of times the ingredients that they say are not in there. Sometimes there's even ingredients in there that aren't supposed to be in them, according to some of the studies that have been done. So I try to take the guesswork out of it for you. I try to curate what I consider to be high quality products. And these are products I use in my practice that I have found useful in my patients as well too. Okay. All right. So let's go ahead and get the next question here. Hello, Jim. Let's see. Hi, Dr. Ross. Thanks for these great webinars. I recently watched a webinar with Dr. Burrascano on BART treatment. He said that people should only take the P5P variety of B6 because he said taking the standard B6 may end up leading to B6 deficiencies through a process I didn't understand. I have great respect for Dr. B, but I could find nothing of this supporting statement. Do you know if people should only take P5P B6? You know, I saw, I had seen, so I participate in some discussion boards for Lyme disease with a number of my colleagues, and Dr. Burrascano is on one of those. And I saw a piece where he had written about this, and I remember reading through it and thinking, well, that's interesting, but I didn't pay enough attention to comment on it, actually. So your question makes me want to go back and look at that now to see what he was saying there. So I don't know the response for you, but I do know he has been saying that. Okay. All right. Thanks for that question, Jim. So everyone, for those of you that don't know, Dr. Burrascano was one of our leading pioneers of treating chronic Lyme disease in this country. And he stopped practicing, I think maybe around 10 years ago now. He's still out there, still actively involved in helping educate physicians and researching different things. And so when he says something, we all kind of pay attention to him still. Okay. So anyhow, that's who Dr. Burrascano is. Rick from Alabama says hi. Hello, Rick. Hello, Patsy. Hi, Dr. Ross. Thank you for these great webinars. You're welcome. Let's see. I have two questions. How is Thor doing after his dental work? And two, I keep hearing that long-term use of antibiotics causes damage. Aside from harming the microbiome, what damage is caused by the long-term use of antibiotics? Okay, so let me talk about who Thor is first, everyone. Many of you know I have two Basenji dogs, and one of them is Thor. And Thor has terrible separation anxiety. And unfortunately, I left him alone one night and did not anticipate what happened, but he was in my camper van one night along with Halo and decided to get upset and took it out by trying to tear apart my steering wheel. And I think what he did, he broke off a tooth there, the top of a tooth, but I think he loosened a number of other teeth as well too. So that's what happened to Thor. So he had to have, I went in initially to have one tooth removed and it came out with 7 gone. He now is, whenever I'm out, when I take him out like that, now he is in a crate. I've got this crate that even he can't destroy. It's made out of all metal. There's nothing he can do to get his teeth on to destroy or hurt himself. So he's protected now, and my van's protected, thankfully. But he's done well. He's recovered well. He's being taken care of by a good friend of mine back in Seattle while I'm on the road here, and she reports back to me daily about his status, and he's out. He's fully recovered. He's his full self again. So thank you for asking about that. Let's see. In terms of long-term antibiotics and damage, any one antibiotic we put you on has a potential of side effects that are unique to that drug. Okay, so for instance, azithromycin can sometimes lead to ringing in the ear and hearing loss, actually. All right. So, but that's unique to azithromycin. And the way you know that's starting to happen is you start getting ringing in the ears and you get muffled hearing. When that happens, you stop the drug and those problems go away. Okay. So like azithromycin, any one drug you take may have side effects that are unique to that drug, and your doctors should be monitoring you for those specific side effects. So for instance, rifampin, which we use to treat Bartonella and can be part of Lyme treatment too, is known to lead to elevation of your liver enzymes and inflammation. And so when you're on rifampin, your doctors should be doing regular liver testing at least every month, maybe every 2 months, to make sure that you're not getting elevated liver enzymes. And the problem with getting elevated liver enzymes is when they get too high. And by too high, I mean above 2 times the upper end of normal. They get too high and they stay there for a long period of time, months, even years, you can get scarring of your liver. Okay. So For instance, one of the liver enzymes is something called AST, a normal range, depending on which lab you use. They'll report that as normal between 20 and 40. So I'm happy if somebody stays at 80 or less, because 80 is 2 times the upper end of normal, which is 40. Okay. So you have to look at each individual drug and see which each one of those can do. And your physician should be monitoring you for those. Okay. All right. But then in terms of other types of problems that we can run into, and there's a growing body of science on this and knowledge about this too, and that is that using antibiotics, prescription antibiotics, can cause alterations in the bacteria that make up your gut microbiome, and that may have some problems down the road too. And to be honest, we're only starting to scratch the surface on the importance of the gut microbiome. Now, I will tell you, in my practice, I tend to try to steer people more toward, or not steer, I offer them herbal antibiotics as well. And in some situations, that may be the better way to go for people because you get into less chance of gut microbiome disturbance. However, even herbal antibiotics can lead to some gut microbiome disturbance. And the way I know that is I've had people on herbal antibiotics like a cat's claw and like a notoba, and they've gone on and developed yeast overgrowth in their intestines. That's a form of dysbiosis, okay? So the things that that we know that a healthy microbiome is involved in is that it's involved in helping digestion, removing things we're allergic to, removing toxins. The bacteria release chemicals that talk to the brain and help the brain work. The bacteria release chemicals that help your mood. The bacteria in your gut release chemicals that help your immune system work well. There's a whole host of things that these bacteria in the gut do. So, there's concerns we have about using antibiotics. However, you have to weigh that against the risk of damage of not getting your Bartonella under control or your Babesia under control or your Lyme under control. And whenever you make a decision to use antibiotics, it's a conversation about weighing risk and benefits. Okay, so the benefit of using prescription antibiotics is you get your germ load down for Lyme and for Bartonella and Babesia, and you start to feel better. Okay, that's your benefit. All right. The risk is harm to the gut microbiome. But at a point, you need to go with the prescription antibiotics because you're so much out of life because of the effects of your Lyme and co-infections that you got to knock those germs down. All right. Now, when it comes to herbal versus prescription antibiotics, in my experience, there are a number of good herbal antibiotics you can use that come close to or equal the potential benefit you get out of using prescription antibiotic regimens. Okay. When it comes to Bartonella, I find that the various Bartonella herbal regimens that I recommend have a benefit effect of about 70 to 75% of people. And then the prescriptions have an 80 to 85% chance of work. So if you're going to choose herbal when it comes to treating your Bartonella, in my experience, it doesn't work quite as well, but pretty good compared to prescription antibiotics. And then when you're talking about Babesia, for instance, herbal options like cryptolepis, artemisinin, and even using those both together seem to work about 80% of the time versus combinations of prescription antibiotics or anti-parasitic agents to treat, and antibiotics actually, to treat Babesia work somewhere around 80 to 85% of the time. Okay. So you need to have, when I talk with my patients and I'm talking with them about risk and benefits of using antibiotics versus not using antibiotics versus using herbal antibiotics, these are all the things that I consider with them. And ultimately, it's a personal choice. All right. So thanks for that question, Patsy. The other thing, what you can do, there's things you can do to help promote a healthy gut microbiome, even on antibiotics. One of those is if you can go herbal antibiotics, use those instead of prescription. Number two, exercise seems to help the gut microbiome. Now, I got to admit, when you have Lyme, chronic Lyme, and you're in the middle of it, sometimes it's hard to think about exercise. But when you start getting to the point that you can start having some exercise, that's another way of promoting a healthy gut microbiome. Number three, be on good probiotics. Okay. So those are just some thoughts that I have. Okay. So good luck to you, Patsy. There's an article that I have written about the gut microbiome. And if I could do screen shares, but they're not showing up tonight, take a look at my Lyme education website called Treat Lyme by Marty Ross MD. You'll find that at treatlyme.net. And if you were in the search bar up at the top, just write microbiome in there. You'll find the article that I published earlier this year on considerations to protect your gut microbiome. All right. Very good. Thanks for our question, Patsy. Hello, L. Let's see. Have you ever seen an exposure to X-rays aggravate Lyme symptoms? Excuse me. I had panoramic X-ray at a dentist's office last week, and that same day I got weird head symptoms and throat issues, which have persisted. I also had a metal hair clip on, which they did not tell me to remove before the X-ray. Don't know if there's some connection. Any reflections? Thank you, and a happy belated Thanksgiving. Well, happy belated Thanksgiving to you too. Thank you. I haven't seen anything like this happen before. And from what I know of the technology, I'm not sure what a connection would be. So I'm not sure. Okay, but I would reflect with you. I haven't seen something like that happen before. Good luck to you all. Hello, Kim. Hold on here just a minute. Let's see. I was positive on the IGenex Immunoblot and positive on the CDC IGenex IgM, and have suffered for 15 years with advancing neuro issues, typical for Lyme, but was tested for years with the old CDC recommendation. Each year, a piece of me changed. I plan to do a Bartonella babesia test as well. Questions. Does it typically take treatment longer for one who is neurocompromised? 2, will maintenance always be necessary after full treatment? And 3, what is the average time for treatment for neurocomplications? And then let's see, are there any particular Lyme germ that invades the system more, or can they be ranked? Was diagnosed for years with orthostatic tremor and have recognized that I do better on a low glutamine diet. I do have the excitatory response to glutamate excess. The neurobuzzing increases where sensitivities are hard to construct. Clonazepam, the first script for OT, is the only thing remotely changes it to tolerable. Any recommendations? All right, so Kim, there's a lot of questions you have here, and I'll try to address those. So in terms of, does it take longer if you have a lot of neurologic symptoms of Lyme to recover compared to people that don't have as predominant neurologic symptoms? In my experience, no. So for instance, I had a patient that had symptoms and had been diagnosed with multiple sclerosis. And when we got in and he was falling down, he had to use a crutch or a cane to walk upright because one of his legs was so weak and dragging. And this had been for years. His doctors had basically just said that he had multiple sclerosis and there wasn't anything they could do. When he came in to see me, I gathered his history, and he had a history of a lot of cat scratches, had tick bites. And so, of course, we did Lyme testing and Bartonella testing with him and came back positive for both. And within 2 months, about 4 months, actually, 4 months of starting on antibiotics that targeted both Lyme and Bartonella, he walked into my office without a cane and was no longer dragging his leg. Okay. All right. And I consider multiple sclerosis caused by Lyme to be one of the more difficult situations to treat. But yet here we are, this person within months of being on antibiotics was back walking normally again, basically. Okay. So I would say that sometimes severe neurologic Lyme, like Parkinson's or MS, in general, may be a little bit harder to treat, but it's not always the case. Okay, it's not always the case based upon that one person, for instance. Okay, will maintenance always be necessary after full treatment? No, I firmly believe that we can wipe out the germs in people that have Lyme. Not in everyone, but in most people. And generally, what my approach is try to get people 100% well. if we can. And if they're 100% well for 2 months, I'll stop treating. The other option is to get them a lot better. And some people, with Lyme, sometimes you have permanent damage that happens. And so my goal with using antibiotics is to get people better. And if they're at a plateau and we're using antibiotics and they've been at that plateau for 4 months, and no matter what we do to try to bring their treatment forward and get them better, nothing changes, then I may consider stopping antibiotics as well too. And most of those people do fine. They don't go on and get worse in the future. But if they do, then I consider that to be a relapse. And those are people that I might, once we get them well again with antibiotics, that I might want to leave on more long-term antibiotics to do germ control, okay? So I think it is possible to eradicate Lyme, but there's also a subset of people that we don't eradicate Lyme and that it becomes a chronic ongoing infection. Unfortunately, we don't have any way to test for that, okay? All right. Let's see. What is the average treatment for neuro complications? An average treatment length for anyone that has Lyme, with or without neurologic complications, is 2 years. Okay. And that's chronic Lyme, not acute Lyme, but chronic Lyme. An average is about 2 years. And I don't think neurologic symptoms change that possibility. Okay. Term that invades the system more. So we now have the ability to test for 8 different strains of Lyme. IGenex, using their test technique called the Immunoblot, can look for a variety of strains of Lyme. In my experience, I don't see that any one of those is worse from a neurologic standpoint than any of the other ones. Okay, so Borrelia burgdorferi was the original United States strain. Now we're starting to see some of the European strains like Bartonella Borrelia guerini and Borrelia afzelii, which historically were more European strains. They now have worked their way across the pond, and they're really predominant out on the East Coast United States now. And when people get those strains, I don't see that they have any worse neurologic complications than people that haven't had those strains, for instance. Okay, the one thing you have to keep in mind when somebody does have strong neurologic Lyme, I always have to consider, is there a Bartonella infection as part of that as well too, okay? And so I usually will wind up asking a lot of questions about Bartonella symptoms, and I may also do Bartonella testing. The best Bartonella test these days, in my opinion, is to actually get the IGenex Immunoblot technique for Bartonella. And what they're able to do with that technique, they're looking to see if the immune system has made antibodies against Bartonella. And they're able to see if you made antibodies against the family of Bartonella, as well as 4 specific strains. And so we think that there may be 15 kinds of Bartonella that you can get. Some from Bartonella henselae is one that comes from cat scratches, but other vectors like fleas, mites, ticks may transmit other kinds of Bartonella strains as well too. And so IGenex has the ability to test for the family. And if that comes back positive, it means you got one of the 15. And of those 15, they can actually tell if they are able to look at for the possibility of 4. Okay. So if the 4 are negative and you still have a positive family, it means you got one of those other 11, basically. Okay. All right. And then let's see. Yeah, I think I covered the major points there. Good luck to you, Kim. So anyway, when I've got somebody with bad neurologic Lyme, I'm thinking on average, just like any other person with Lyme without bad neurologic, we're talking 2 years of treatment on average. All right. Some people get better quicker than that. All right. And then the other thing I'm thinking of is look and consider treating for Bartonella. Key symptoms that make you think of Bartonella are pain on the soles of the feet, neurologic symptoms like tremors and shakes, like you mentioned here, okay? Bad anxiety or bad depression or hallucinations sometimes can be that. Sometimes people with Bartonella have a lot of air hunger, and the reason they get air hunger is there's deposits that form on the inside of your blood vessels that start limiting the flow of blood, and so you can't get enough oxygen flow through the smaller blood vessels in the body. All right, so that produces something called air hunger. Sometimes people with Bartonella have these rashes that look like stretch marks, and that's another sign that you can look for Bartonella as well too. Okay, If you're looking for tips on how to diagnose Bartonella, on my Lyme disease information site, Treat Lyme, by Marty Ross MD at treatlyme.net. There is an article. If you go to my online Lyme guide there, you'll see that there is a section called How to Diagnose. And in there, you'll find my article about how to diagnose Bartonella. Okay? All right. Again, I'm having a hard time doing screen shares. For some reason, my the screen share option is not working on my laptop computer tonight. So I'm telling you where to go instead of showing you. Okay. Good luck to you, Kim. Hello, Joe. Hey, Doc. Thanks for being so kind to do this. You're welcome. Quick question. I can't take cat's claw due to an autoimmune response. Is it okay to take Otoba bark by itself? You can use Otoba bark by itself, but I don't think it will do as well for you. Other things you could substitute or take in addition to Otoba bark, you could look at using Japanese knotweed is an option. And I usually will try to have people work up to 30 drops twice a day, maybe even 30 drops 3 times a day on that. Another alternative you could take would be teasel root, Teasel root. And I would work that up to 30 drops twice a day. Believe it or not, there's data that came out last year, or maybe it was earlier this year, that showed from research at Johns Hopkins University, showed that cryptolepis, which is something we historically use as an antiparasitic to treat babesia, research out of Johns Hopkins shows that cryptolepis is good at treating growing Lyme and persister type Lyme, and growing Bartonella and persister type Bartonella as well too. So things you could combine with Otoba bark would be either teasel root, Japanese knotweed, or cryptolepis, any of those. Okay, those would be the things you could combine with that. In terms of, yeah, and cryptolepis, I dose cryptolepis very high. I know a lot of people are alarmed when they, some of my patients are like, or people in these webinars have written me to ask me, do you really mean that? And I do. What I dose cryptolepis at is a teaspoonful 3 times a day. You can start at a half teaspoon 3 times a day, but I try to work up to a teaspoonful 3 times a day on that. And if you do cryptolepis, it is a foul tasting herb. I just want to warn you about that one as well too. Okay. All right. So if you're looking for some of these ideas I just talked about, take a look at, I may have written about these within my Lyme disease antibiotic guide. You might be able to find some of these ideas there. Okay. All right. Take care, Joe. Thanks for your question. Let's see. Hi, Ron. Let's see. Does IGenex find babesia? Yeah. So IGenex has a number of tests they do for babesia, but they have a new one that's probably a lot better than the previous one. So the new one is they have developed a test called an immunoblot. And again, what an immunoblot does is it looks to see antibodies against proteins found on the germ. And in the immunoblot technique, what they try to do is use what I call cleaned up proteins. They take bacteria in the lab and program them to produce the babesia proteins, basically. And so they're looking to see if you have antibodies in your body that your body would have made against babesia, and see if they attach to these cleaned up lab produced proteins. The issue with doing cleaned up versions is you decrease the chances of a false positive test, basically. Okay. And so that test seems to be really good. So you could do the IGenex Immunoblot. We also used to be able to do antibody testing using a technique called an IFA technique to look for Babesia decani and Babesia microti, but I wouldn't do those anymore. With this new Babesia Immunoblot test, I think it's a better way to go, basically. Okay. Good luck to you, Ron. Let's see. Hi, Cassie. Let's see. Hi, Dr. Ross. Let's see. I enjoy these Q&A so much. Thanks so much for doing them. You're welcome. I appreciate that. You got a question here. Hold on a minute. Oops, I just messed that up. Hold on a minute. Oh, Cassie, I'm sorry. Somehow, I'm trying to get your question pulled up. I marked it. Let me see if it shows up here somewhere. I apologize, Cassie. I tried pulling up your question and something happened here. I don't know where it went to. Oh, here we are. I found it. Let's see. My question for you is, I have this internal vibration mostly at night, and I wonder what it's from and what can help it. Thank you so much for sharing your knowledge with us. I look forward to these weekly. So, Cassie, when I see somebody that has the sensation of internal vibrations, some people will call it internal or a buzzing sensation as well too. When I see those kind of symptoms, I'm thinking of Bartonella. All right, or I want to explore and see if Bartonella is possible. And what I like to do specifically is I like to go ahead and get is to look at the list of Bartonella symptoms, which I reviewed earlier tonight. And then I might consider getting Bartonella testing too. Again, you could find my article called How to Diagnose Bartonella. Go to my website, treatlyme.net by Marty Ross MD. And then in the search bar, just write How to Diagnose Bartonella, and you'll find my article that I've written about that. Okay, so I would consider that. Okay, all right. It's a neurologic sensation that you have. Okay, usually I see that in Bartonella, sometimes Lyme, but usually Bartonella. All right, so you would want to treat the appropriate infection. So consider if you got Bartonella, make sure you're doing something to kill Bartonella, okay? The other thing that you can do to quiet that vibration down that I have found helpful is to use magnesium, sometimes helps. And you can take anywhere from 400 to 600 milligrams at night before bed. One of the things to be aware of, magnesium makes you sleepy, okay? So if you're going to take it before bed, it might help you get a better night's sleep. Okay. All right. So that's one thing you could wind up doing there. All right. The other thing I find helpful for these sensations of buzzing like this is to use an herbal medicine that is a component of green tea, and it's called theanine or L-theanine. So L-theanine. And if you use that at 100 milligrams before bed, you could even take it up. And I'm sorry, I would start more at 200 milligrams before bed. And you can even increase it all the way up to 600 milligrams before bed. Theanine is a non-caffeinated form, or is a non-caffeine chemical found in green tea, okay? And in the brain, it is converted over into a chemical called GABA. Our brain is loaded with these things called GABA receptors. And if you give more GABA to a GABA receptor, it helps quiet down agitation, basically. It can make you sleepy as well, too, okay? The other thing that it does is it has a direct effect on nerves in terms of decreasing the neurologic amplitude of the signals that travel down nerves. So that makes them less agitated as well, too, okay? So that might be something you consider before bedtime, okay? So it's L-theanine. The company that makes it is Integrative Therapeutics. That's the product I carry at my store. And it's a 100 milligram pill. Okay. Right. Good luck to you, Cassie. Let's see. I'm just looking. There's some repeat questions here, so I just want to make sure I don't read those twice. Hello, Sarah. Let's see. So I recently went to an immunologist to test various parts of my immune system. The immunologist knows I've had Lyme and several co-infections and reviewed all my previous labs. She wanted to look at a bird's eye view of my entire immune system instead of relying specific antibody tests that I've had. That made sense, so I had some labs drawn a few weeks ago. Of the labs she ordered, several of them came back high abnormal. CD4 positive, CD4-8 ratio, and every single antibody in the pneumococcal category came back low. So she wants me to get a pneumonia vaccine to see if it will help to stimulate this entire category of bodies. Are these high levels of CD4, CD8, and low pneumococcal levels typical with somebody with long-term chronic Lyme and co-infections? Since I've had such flare-ups and skin lesions after getting the COVID vaccine and boosters, I'm hesitant to get another vaccine, especially if you don't think a pneumonia vaccine will help stimulate. So I apologize here. For some reason, I've got all of a sudden a lot of postnasal drip coming about here. So you hear me coughing here a little bit. That's what's going on. There's a little stirring up of my allergies here for some reason. But anyhow, I have to be honest. I have a hard time commenting directly on labs like this without knowing more specifically about your picture. So I'm not going to be able to make a direct comment on the C4 and the C4 or CD8 ratio, okay? Because I would need to make those in context of knowing more about your history than what you've been able to put down here. And I would need to know, so I would need to make more specific comments about that, okay? But we do think that when you are not, I think I'm just going to leave it at that. I'm concerned about giving too much information without knowing more about you. So I'm going to leave it at that. I'm sorry, I'm not going to be able to answer this one for you tonight. Okay. All right. Good luck, Sarah. Hello, Astrid. Let's see. Thank you, Dr. Ross, for all that you do. You're welcome. You are loved. Thanks. I have taken antibiotics for 7 months and can't tolerate them anymore. I've been off of antibiotics for only 3 weeks and my symptoms from BART are returning. My LMD prescribed diflucan, OO, and monolaurin. What should I add to this regimen to perfect it? You mentioned many things in your Bartonella brief guide. So first of all, I'm not sure what OO is here. And monolaurin, I don't recognize as something that I would use for Bartonella. I think monolaurin, I'm aware of it as having antiviral activity. I haven't seen any experiments that have been done suggesting that it is an agent that can treat a Bartonella, okay? Diflucan is part of a member of antibiotics called the azoles, and probably about 4 years ago now, there was studies done at Johns Hopkins University where they chose a representative of each major antibiotic group and tested them against both growing and persister forms of Bartonella, or states of Bartonella, I should say. And they found, and the azole that they used in the experiment was something called clotrimazole, which is actually found in vaginal yeast creams and skin creams for treating fungus infections. But they found that it was really effective against growing and persister forms of Bartonella. So I have, maybe over this last year, I've started using a lot of diflucan in my practice based on that, and I've been having really good results. So I think you're on a good agent with that diflucan. I don't know what OO is because I'm not sure what you mean by that. In terms of if you're looking, so the other comment I would make here is what caught my eye in your history there was that you said that you stopped antibiotics and 3 weeks later, your symptoms got worse. Okay. So that is something we see with Bartonella. And the reason we see that is that Bartonella replicates really fast. About every 24 hours, the germ replicates itself. And so it's quite common when you stop a Bartonella treatment too soon before you're done, you'll start getting symptomatic with your Bartonella symptoms getting worse at about 3 weeks to 4 weeks. Okay, that's the picture there. Lyme, by comparison, grows a lot slower. And if you stop treating Lyme before its time, you'll usually start getting more symptomatic about 7 to 8 weeks out. Okay, so you can kind of use your decline, how quickly a decline happens, to kind of give some information as to which germ is the problem. Okay, all right. Now, other things that you could add and combine with a diflucan if you want to go herbal, things that might be helpful would be like a Japanese or the two that I usually would start with my patients would be Hutania and Sita Akuta. And those definitely I have found helpful in managing Bartonella. And then because your diflucan also can pick up the persister forms of Bartonella, you're covered for both growing and persister. Okay, so what are these persister things I keep talking about? So let me just talk about that real quick. So the Lyme germ, and which is Borrelia, and Bartonella, we know from experiments over the last 5 years, have the ability to be in different growth states. There's a majority of the germs exist in a growing state, okay? And about maybe 10% or so of the germs, at least according to laboratory experiments, may go into these hibernating state, or we call those persisters, okay? And so those persisters tend to ignore the classic antibiotics we've used against them. And so there's been a hunt going on, research going on, trying to figure out what do we use against them, okay? So again, the fluconazole is something that can go after those persisters. So when I do my treatments these days, I try to include in my Bartonella treatments, as well as in my Lyme germ treatments, things that target growing phase, and also antimicrobials that will target the persister phases, okay? So in this case, a diflucan coupled with a Psittacuta hutania appear to be good against growing phase Bartonella. And I think combining with diflucan, I've done treatments like that and have had reasonable success with that, okay? So those are things I would try with a patient of mine, okay? All right. But you're not a patient of mine, so these are things you probably ought to talk with your regular doctor about as well, too. Okay. All right. Thanks for that question, Esther. Good luck to you. Let's see. Esther also says, I plan to add a peptide to this regimen as well. Which peptide do you recommend? All right. So many of you may know peptides have kind of become the new rage set of treatments in Lyme disease. And I think for good reason. I think there's some good things that are happening with it. So peptides, everyone, just for the sake of that discussion, let me just make sure we're all on the same page here. The building block of a peptide is something called an amino acid. Amino acids are also the building blocks of proteins. Okay, so what distinguishes a protein from a peptide is proteins have 40 or more amino acids. All right, so anything less than that is something we call a peptide. All right, now peptides occur naturally in us. All right, so we manufacture a group of peptides, and one of the ones that is really useful as kind of your foundation treatment if you're going to use peptides for any purpose is to use a peptide called BPC 157. BPC 157 is kind of the Swiss Army knife, if you will, of peptides, okay? And it does a number of things. First of all, it's manufactured in the stomach lining. That's where it comes from naturally. And the purpose in the intestines is to help to improve intestinal injury, basically, okay? But it's been found within the athlete community that it can help repair joint and muscle and tendon and ligament injury. And so that's where it's been used in a big way. What I find in my practice is that it's useful repairing injury. So can help with injuries of your muscle tendons and ligaments. Therefore, you get improved pain in those areas, okay? It helps improve gut function. In my experience, I've found it to help with neurologic injury, so cognitive thinking problems, for instance, or neuropathies is something I'm seeing good benefit with that too. It has the ability to help with energy, your cell energy factories called mitochondria. It can help improve their function as well too. So there's a whole host of things that it can do. So usually if I'm going to start peptide therapies, that's where I'm going to start, okay? And the way that you'll do that is start out 1 pill twice a day. And that's kind of where I start with most of my patients. All right. I also have an article about peptides. If you were to go to treatlyme.net and in the search bar, just write peptides, you'll see my article about them. I will let you know that peptide article will be updated as I publish my new book somewhere in mid-December. As part of publishing that new book in large part is a compilation of key articles from my treatlyme.net site. But I have rewritten the peptide article as part of that. And so it's a bit more expanded, and I just haven't changed it over on the website yet. But as I get ready to publish the book, I will be updating that article as well too. Okay. All right. Good luck to you, Esther. Thank you for that question. Hello, Adrian. Let's see. I started your herbal protocol for the past week to treat Bartonella. You did mention that you should treat Bartonella prior to Babesia, but I've noticed that one of the herbs I'm taking for Bartonella overlaps for treating Babesia, which is cryptolepis. Is this a problem? Should I add the artemisinin to do a complete Babesia treatment while treating Bartonella? Also, I read a study that shows that artemisinin doesn't work well against Babesia microti, which I have. Do you find this study to be true? All right. So, I'm not your physician. Okay. So I don't know everything about you, but I can just make some general comments about this. Okay. So I can't tell you what to do because you're not my patient. And I know you're following some of the things I've written. What I would say is cryptolepis is an effective agent against Lyme, Bartonella, and Babesia. And, I use it as part of my Bartonella treatments for some of my patients, and I use it before I do an aggressive targeting of their Babesia. So I think it's okay to not do anything more for Babesia, but rather just use the cryptolepis with the other herbs you may be using for Bartonella and not do anything more to go after Babesia. That's the first thought. Secondly, I agree. The artemisinin may not be working as well against what I've tended to think of it is it's not working as well against East Coast Babesia. But I think it's true. We're starting to see it's not working as well against Babesia in general. I have not read that specific article, but I am aware that it tends not to be working quite as well all the time. I still try it. If it doesn't work, usually, and if within 1 or 2 months of being honest, somebody's not having an improvement of Babesia symptoms, I'm going to stop it. Okay. But it is true. We're starting to have some concerns that artemisinin may not be working as well for Babesia. Okay. Thanks for our question. Hello, Gemma. Let's see. Hi, Dr. Ross. Is it true that CoQ10 should not be taken when on Malarone? And is there something else you recommend to patients that are not tolerating cinnamon, clove, oregano in place of it? Is alicinin any good? Thanks a million. All right. So CoQ10 should not be taken with Malarone. So CoQ10 interferes with the effect of one of the components of Malarone, which is called atovaquone. Atovaquone is also found in Mepron. Okay, so usually I suggest you don't take that. And all right. And so then in terms of the second part of your question, so, I like using liposomal cinnamon, clove, oregano because it is very useful against persisters. It can also treat growing forms of Lyme and Bartonella, and it treats persister, Lyme, and Bartonella, and may help remove biofilms for those as well too. Okay, so that's why I like using it. But if I have a situation where somebody cannot tolerate it, then what I'm going to use to replace it as something that can do all those same things would either be cryptolepis, or I would replace it with Japanese knotweed. And the only thing that the knotweed, though, and the crypto won't do is they're not going to do anything for biofilms, but they will be useful against growing and persister forms of Lyme and Bartonella. A Japanese knotweed dose I might work up to would be 30 drops 3 times a day. A cryptolepis dose I might start at 2.5 milliliters 3 times a day, and then increase that up to 5 milliliters 3 times a day. And yeah, that's a lot, and that is what I recommend. Okay. All right. But you might also want to talk these things over with your physician as well to make sure they're right for you too. Okay. All right. Thanks for that question, Gemma. Good luck to you. Hello, Adrian. Let's see. I've read through all of your site, and I still have trouble differentiating the symptoms I'm having are Babesia or Bartonella. Chest pain, rib muscle, digestion issues, fatigue, and sometimes breathing issues. So there is overlap. How do you differentiate between the two? Oh, Adrian. This is one of those things where it's kind of a clinical sense, and to gather that and I would also want to ask you a lot more questions too, as I have to admit, those symptoms don't necessarily fall into one of those categories. So I would need to ask you a lot more of your history, a lot more symptom questions than you've done here, and I might consider testing with the Lyme, with the Bartonella and Babesia Immunoblot test through IGenex to help as part of that too. Okay, all right. Good luck to you, Adrian. Hello, Rick. Let's see. Thank you so much for your excellent web sources. Much appreciated. You're welcome. Let's see. I have possible Lyme infection with a suspicious rash, but no other symptoms. I did get a blood test, which found positive IgG. It is now over 3 months since the rash occurred. I have no definite tick bite, but I was in a part of France that has a lot of infected ticks. All that remains is the ongoingly unsymptomatic rash. I score 14 on the Horowitz questionnaire. My question is, as I'm rather opposed to conventional antibiotics, would you recommend following your biocidin protocol just in case? Many thanks and best wishes. Boy, Rick, I don't know. And the reason I don't know, part of the problem, you're kind of asking me to diagnose, do I think you have Lyme? And this is a webinar format. I can't diagnose conditions here. That's something physicians would do if you have a one-on-one relationship with them, okay? I got to admit, you have some things here that make me wonder about Lyme, but I don't know enough. I would need to ask you a lot more questions about symptoms beyond what you've stated here. Making the diagnosis of Lyme, we consider 4 things. One, are you in an area, have you been bitten by a tick? Or have you been in an area where there may have been ticks that could have bit you? And in that area, there's quite a bit of Lyme. Okay. All right. So is there a risk of getting it? All right. And you've said, yeah, I mean, what you've laid out here says, yeah, you probably have been in those kind of areas. All right. Number 2, we look at what are the symptoms you have, and are there enough of those symptoms that we see in Lyme? And you gave me the Horowitz score, but even that's a lower Horowitz score. Okay. And the Horowitz questionnaire is a questionnaire that looks to see, do you have enough symptoms and risk factors for getting Lyme? And if you score high enough, we call that. It could be that you have Lyme. Okay. You have a lower score. Okay. It's not one of the like 40 or 50 scores that you sometimes can get there. Okay. All right. The third thing we look at is, do you have any testing that supports it? And what I would say is an IgG is a type of antibodies that develop and will remain even after the infection is gone. All right. So I can't tell by looking at an IgG whether it's still active in you or not. And then the last thing we look at is, are there any physical exam findings? All right. So I don't want to do a diagnosis here in a webinar format. This is something you should seek out care from a Lyme literate doctor to see if they can give you some advice as to whether you really have Lyme or not. I can't tell from what you wrote here. Okay. All right. Good luck to you, Rick. Hello, April. See, how accurate is the ELISA test in detecting Lyme disease? The ELISA test has been studied looking to see how accurate it is, and studies would suggest it will only find Lyme about 50% of the time that it's there when somebody has chronic Lyme. In terms of a useful test when somebody has acute Lyme, it may have a better chance, but in terms of chronic Lyme, it looks like it fails about 50% of the time. Okay, that's based on a number of studies that have been done. I wouldn't rely on it. In fact, the CDC method of doing an ELISA test first and then following through by doing a Western blot test only if the ELISA is positive is resulting in 50% of people that have Lyme never getting determined if they have Lyme. Okay, all right. Thanks for your question, April. Good luck to you. Hello, Dana. What kind of treatment would you recommend for pregnant women with babesia? Oh boy. So first of all, I would talk to your physician. Yes, because it's pregnancy. That is something that you should be talking with your physician about. I haven't had to manage somebody with babesia in pregnancy before. I believe, though, from readings I've done before, and this is way in the past, I believe that Mepron is okay to use in pregnancy if you need to, which is atovaquone. And that could be combined with azithromycin, which is another way something that we use in addition to atovaquone Mepron whenever we use it. All right. So the drugs, but I have to go back and read the literature a little bit more, but my last reading of it that I'm remembering from a while back, okay, so I hope you understand all the warnings I'm giving you here, is that I think atovaquone is safe to use in pregnancy, and I definitely know that azithromycin is safe to use in pregnancy. And if I were to go back and review the literature again and find that atovaquone is safe to use in pregnancy, then I would probably build a treatment, if I had a patient like in your situation, that would use azithromycin and atovaquone, which is also called Mepron. Okay? All right. Good luck to you. Hello, Santiago. Hi, Dr. Marty. In your opinion, on the oat test, if a Rabinos value of 36 is high, is there a high chance of yeast overgrowth? Santiago, I have stopped using oat testing, organic acid testing, to try to figure out if there is yeast. And when it comes to the Arabinose question, there are other things that may elevate Arabinose, and it is probably not 100% reliable at determining if a person has yeast overgrowth or not, unfortunately. Okay? All right. Good luck to you, Santiago. Hello, Frank. Dr. Ross, my wife has been struggling with constipation and recently had a Genova stool test done. One of the results was positive. 10 on a scale of 1 to 10 for metabolic imbalance and the need for prebiotic support. The only other finding was 2 for dysbiosis, showing a mildly elevated reading for yeast. Have you seen findings like this, and what kind of symptoms could one expect to see with this kind of prebiotic deficiency? Also, would you do anything for the yeast? So first of all, I don't find that testing of stool for yeast is 100% reliable. What you want to see is there yeast overgrowth? And yeast overgrowth is a relative issue. And here's what I mean by that. So all of us have Candida albicans, which is yeast living in our intestines. All of us do, okay? The issue isn't that you find it. The issue is that in your intestines is the amount that's in there too much. So I might be able to tolerate the amount you have and never have any trouble, but another person might have trouble, okay? So it's a relative issue. So symptoms that suggest too many yeast are a lot of intestinal gasiness and bloating, Yeast release toxins that get into your bloodstream and can interact with your skin, leading to worsened eczema, maybe producing hives. Actually, worsened eczema, pimples, and acne. Yeast in your intestines that are overgrowing will trigger mast cells that line your intestines, which are your allergy cells, to release a lot of excess histamine. So you might start having more allergic symptoms. You might become more reactive to various foods. You might develop hives, for instance, okay? Other symptoms that can suggest too many yeast is if you've got too many intestinal yeast in women, you might get too many vaginal yeast. So you can have vaginal itching and vaginal discharge, all right? And the other thing that makes me wonder about active intestinal yeast is if somebody has something that's obviously sugar, simple sugars, and they feel a lot worse. That can sometimes indicate that you have too many yeast. So I don't find testing reliable for yeast, all right? In terms of dysbiosis, that means that this lab is finding that you've got some imbalance between healthy bacteria. Being on prebiotics may help with that. Probiotics will help with that as well too, okay? But I would need to know more about what's happening history-wise about whether yeast is a real issue or they just happen to find it growing in the lab, okay? All right. And then one other thought I have for you. One cause of constipation that is not seen on this Genova test that you had done is a condition called SIBO, small intestinal bacterial overgrowth. And SIBO, which means you've got bacteria living in your small intestines that aren't supposed to be there, can sometimes lead to constipation. And that is the bacteria that live in your intestines will ferment the food that you eat. And one of the gases that they may release is methane. And methane type SIBO can lead to severe constipation. Another type SIBO that people can get is hydrogen type SIBO. And that tends not to give the constipation, but methane does. So if your wife is doing a lot of burping, having a lot of gassiness and bloating, and having constipation, then you may want to talk to her doctors about possibly looking for SIBO. And the way you look for SIBO is to do a breath test where you drink a sugar called lactulose first, and then about every half hour over a 2 or 3 hour period of time, you blow your air into these little collection tubes, and then your breath, into these collection tubes, and then you send it off to the lab and they measure gas levels in there, okay? All right, just something to think about, okay? All right, good luck, Frank. Good luck to your wife, that is, too. Hello, Stephen. Let's see, what time are we at here? Let's see, hi, Dr. Ross. Once again, thank you for running these webinars. You're welcome, by the way. Let's see. I was just looking at the time. I thought we'd been doing this a lot longer than we have been. We got about 20 more minutes to go. Anyhow, see, I've been having a problem with my left foot leg. When I wake up in the morning, both the bottom of my feet hurt. However, my left leg feels funny. Sometimes it's a bit numb, and sometimes it feels like it's inflamed, yet can't see this. I also feels like it's locked up, and some seems to be getting worse the more herbs I have introduced. I have introduced Houtinia over the last few weeks. The weird feeling has been there around 12 months now, but only seems to be getting worse the more herbs I introduce. Have you any suggestions what could be causing this? I'm taking glutathione, curcumin as well, plus cat's claw and Japanese knotweed. Thanks again, Steve. Let me see here. Steve, bear with me. I just want to read back to the beginning of your question here. So, Steve, one of the things I would consider, and you probably ought to be talking to your physician about this, the fact that you're getting what I would call neurologic symptoms of your leg locking up an odd feeling in your leg, which is neurologic, and these seem to be getting worse at nighttime, make me wonder about a positional change of something pressing on your nerves while you sleep, which could be occurring either in your back or somewhere along the path of the sciatic nerve. This is something I would talk to your physician about and see if they can help diagnose whether you have some type of anatomic or architectural problem leading to some dysfunction of the nerves as you sleep. Okay. All right. So I would go ahead and talk with them about that. Okay. All right. Good luck to you. Hello, Heidi. Let's see. How do you decide which antibiotic is best for a client for Lyme? No co-infections. A lot of it depends on what kind of symptoms they're having in general, not just Lyme by calling it Lyme, but Lyme manifests different ways. I'll make one comment. One treatment one antibiotic I'd like to start with in most of my Lyme treatments is to use doxycycline. And doxycycline is useful for treating spirochete appearance of Lyme as well as the cyst appearance of Lyme. It will also treat Lyme that lives inside of cells, okay? The other reason that I go for it, though, is that often people with Lyme have a lot of myalgia, muscle achy type symptoms. And those symptoms often can be related to having or might be part of anaplasma and Ehrlichia, which are two other Lyme co-infections, okay? And doxycycline used for at least a month will take care of those, okay? All right. So often I will start with a doxycycline and then I might combine it with something to treat cyst. And doing that, I like using herbal. I like using a grapefruit seed extract, 250 milligrams twice a day, okay? So again, the Lyme germ, let me talk about terms here. Lyme germ has appearances, that means what it looks like, and Lyme germ has different growth states, okay? The growth states are growing and hibernate or persisters, okay? So the appearances are corkscrew-looking things. We call those spirochetes. You've probably seen pictures of those on the internet. Lyme also likes to live inside of cells, and it loses its covering when it moves in there, and we call that the L form. And then Lyme lives outside of cells in a microscopic cyst form. We call that a cyst, okay? When you design a treatment for Lyme, you have to treat all of these different forms. So the L form, spirochete, and the cyst form, all right? Now, we know from laboratory experiments that the spirochete and the cyst can go back and forth, can morph and change to each other, all right? But we also know that they can be in a growing phase and they might be in hibernating persister phase, okay? So the other thing you need, and then regarding these forms, different antibiotics do different things. So doxy is good for intracellular L form and spirochete in a growing phase, okay? Not for the persister, okay? Grapefruit seed extract helps treat the cyst form, all right? But we don't know whether it does anything for persister cyst or not, all right? So then the other thing that I'm tending to add to most of my treatments these days is to use liposomal cinnamon, clove, oregano capsules. And that is because they can help treat a persister Lyme. They also happen to pick up growing Lyme as well too, all right? But you get coverage for the persister aspect of it as well too, okay? All right. So good luck to you, Heidi. If you're looking for various antibiotic options, take a look at my Lyme disease antibiotic guide at treatlyme.net. In there, I lay out 10 different possibilities of starting regimens for treating Lyme. Okay. All right. Good luck to you, Heidi. Hello, Thomas. Let's see, can you tell us more about what services on the website will be available when you stop treating? Is this a paid website, open forum type setup? Maybe none of my business, but did you have any attacks on your medical license causing the closure? Good question. So I'm trying to be very clear about this. I'm doing this as a lifestyle change. I'm at a point right now where, I'm 60 years old, all right? So I have been treating chronic Lyme disease 2004, and I'm just wanting to make a change away from doing the clinical practice. Having said that, I still love helping people. And even though I want to make a change from doing clinical care, I still plan on supporting people with Lyme disease. And the way that I'm going to do that is my Treat Lyme by Marty Ross MD is going to still exist, and I will keep updating it based on the latest information that I have. Okay, so that's going to stay current. Number two, my Lyme disease supplement store, Treat Lyme, which is Marty Ross MD supplements. I will keep that store going. That is going to be with me down in Austin, Texas, which is where I'm planning to relocate when this is all done. I've been there before when my license was in trouble before, but I don't have a license problem right now at all. And then the new thing I'm going to be starting up is I'm going to be starting an online support group. A community. And I'm in the phases of trying to get that put together right now. I'm not going to host it on Facebook as a Facebook group. We'll be using a different platform to do that, but it will be a forum where you can get support from people that have Lyme. And in addition, as part of that, I'm going to be having I might even be having daily office hours where people can ask me questions. I'm still trying to decide the format on that. And because it is a community-driven group that I'm going to be setting up, there'll probably be other things that we do within there too. Anyhow, I'm in the process of trying to get that set up as well too. So I'm not going away. I want to make a change from doing clinical medicine. I think I can do more to help people by keeping my online information site up to date, by hosting a community where I can have contact with many more people than I can one-on-one, and by writing books. So for instance, I have a new book that's going to be coming out probably mid-December is what that's starting to look like on treating Lyme disease. I anticipate writing more books. The other thing I will do after I get my patient-oriented community launched is I'm going to set up a community for practitioners that need help managing Lyme disease, so that people that are new to this or newer to this can we can sit and talk and help them on their way as well too, because I want to try to promote more practitioners treating Lyme. So I need to free up time so I can do more to help the Lyme community than I'm able to do just working one-on-one in my office. And so I'm not going away. I'm staying very active in the Lyme world here. Okay. Just want to make a turn at age 60 and go in a slightly different direction. Okay. All right. Thanks for that question, Thomas. Hello, TJ. I read in the bio where you treated chronic fatigue syndrome in the past. What percentage would you say you were not able to help people resolve? And in those cases, what is your theory of what caused their fatigue? I don't know. Well, let me just make an observation here. So when how I came to treating Lyme disease was going way back to 1995. In 1995, I moved to Seattle, Washington, from Washington, D.C. And my first job when I got to Seattle, Washington was being a medical director of a clinic system that who targeted and worked with people that had low income and were ethnic and racial minority groups, basically. So it was a community health center. And in one of their clinics, they were wanting to establish an alternative medicine clinic. Okay. And the reason I was hired is I was open to that. So we did that. We did get that going at the Kent Community Health Center outside Seattle, Washington. And as I worked side by side with all these naturopaths and acupuncturists, and massage therapists and chiropractors, I started thinking, I want to do that myself. That's great medicine. And so the problem is in that system, though, is that the physicians, the MDs, were reimbursed. We got a lot of our grants and reimbursement were based on the number of people we saw, not on doing good quality medicine. And when you work with alternative medicines, you've got to be able to spend half hour, 1 hour visits with a person. You just have to take time. acupuncture training and started offering acupuncture. And soon my waiting room started filling up with people with fibromyalgia. And because they had, so many of them had fatigue, I got training with Jacob Teitelbaum. Dr. Teitelbaum, many of you know, wrote a book called Fatigue to Fantastic with ideas on how you treat chronic fatigue syndrome. And so with the training with Dr. Teitelbaum and then my acupuncture background, my waiting room became full of people full of fibromyalgia and chronic fatigue syndrome. Okay. So then in 2004, one of those patients said to me, I think I have Lyme disease. And I said, you don't have Lyme disease. We don't have Lyme disease in Seattle. Boy, was I wrong. So I went back and I did test her and it came back positive. And it was an eye-opening experience for me. And so it made me go back and relook at all of my patients in my practice with chronic fatigue and fibromyalgia. And I tested every one of them for Lyme disease. And what I found is about 30%. In my Seattle practice, 30% of those people that had been told they had chronic fatigue syndrome, fibromyalgia by me, actually had an underlying infection, Lyme. All right. Most of them never remembered a tick bite, but it was an eye-opening experience. Okay. Now, in terms of, chronic fatigue, what I have found is, in working with people with chronic fatigue, when you open up the idea that many people with chronic fatigue actually may have underlying infections as part of this, by the time you address that and you address mitochondria dysfunction and you treat things like mold toxicity if they have it, you start looking for all these other causes of fatigue. Generally, I think probably about 90% or more people with chronic fatigue can get better, to be honest with you. But you've got to correctly identify what it is. And so you've got to look for mold toxicity, which can give ongoing fatigue. You've got to look for tick-borne infections, which can give ongoing fatigue. You got to treat mitochondria dysfunction, which can give ongoing fatigue. So there's a lot of things you got to address to try to reverse the situation. Okay. All right. Thanks for that question, TJ. Hello, Brandy. Let's see. Are there any specific telltale signs or markers to distinguish between eczema versus psoriasis versus Lyme-related skin issues? When you go to the dermatologist, they're not just guessing and don't actually culture or run any biomarker tests. Thank you. So the only test that you can do for sure to make sure it's not eczema versus psoriasis would be a skin biopsy. Okay. And that's something a dermatologist can do. The one thing they may not be aware of is that Lyme can also lead to a condition called Morgellons, because they don't agree there's something called Morgellons. But they can at least distinguish with a biopsy between eczema and psoriasis. Okay. All right. Thanks for that question, Brandy. Hello, Ron. Let's see. Dr. Ross, thank you for providing these informative webinars. I found a bullseye rash on my wrist 2018 and naively failed to get medical attention. So to make a long story short, I suspect I was bit by what was called the Lone Star tick, as I live in Texas. If correct, the symptoms I have would fall under the label Southern Tick-Associated Rash Illness, STARI. I was tested twice with CDC's recommended way to test for Lyme, both times negative. As you clarified in a prior webinar, these CDC tests are strictly for Burgdorferi Lyme. Do you know if CDC or anyone in the medical field have identified the bacterium associated with STARI? And if yes, do associated blood tests exist to identify the presence? Wow. I don't know. I haven't had, because my practice has been Seattle based. I haven't had the occasion of working with somebody that had STARI. And I haven't looked into it. I don't know, unfortunately. I'm sorry about that. All right. Good luck to you, Ron. Hello, Mosby. Let's see. How about very cold hands after taking anything that kills bugs? Is this a Herx or Raynaud's? And is Raynaud's genetic? So Raynaud's phenomenon, Raynaud's syndrome, basically occurs when you get into spasms of the small blood vessels that feed your digits in your fingers, or your digits in your hands and in your feet. Okay. And when they go into these blood vessels go into spasm, it can turn your hands blue. It can turn them white. They can be quite painful. The things that are known to set this off tend to be temperature variations, like heat or cold. Any of those can set it off. All right. And the treatments that we tend to use for them would be to keep those blood vessels dilated. Things like nitroglycerin can do that. A group of prescription blood pressure medicines called the calcium channel blockers can do that. I have found using ginkgo biloba as an herb, which helps make your blood flow easier into tight spaces, sometimes can help with that. But in terms of seeing it get worse as part of killing germs, as part of a die-off or a Herx reaction, I haven't seen it. And I have not seen herbal medicines cause it as well either. So it isn't something I've seen, Mosby. Okay. I'm not saying it couldn't happen. I'm just saying I haven't seen it happen. All right. Good luck to you. Hello, Christine. Let's see. Thank you for your advice from a couple of weeks ago. I asked you about a very swollen lymph node, and you said indeed turned out to be an inguinal hernia. Thank you, and I'm actively dealing with it with success. I love your info. Wow, I'm glad you got that checked out, and I'm glad I told you to check that out. Thank you for sharing that, Christine. I appreciate it. Hello, April. Hi, Dr. Ross. My son just got Lyme in September and soon after that developed UTI type of symptoms. We saw a couple of urologists and antibiotics and muscle relaxer and haven't helped. Any suggestions? So by UTI symptoms, I suspect you mean, so let me just talk about what I mean. So it's the same thing that you do, okay? So urinary tract infection symptoms usually would be burning, maybe some bladder area pain, urge to pee frequently, and then going to the restroom frequently as well too, okay? So those type of bladder symptoms. That often can be related if there is not an infection, and I would assume that somebody has done bladder culture, urine culture, to make sure it's not a common bacterial infection. Sometimes that can be a condition which is known as interstitial cystitis. Interstitial cystitis means that there is inflammation within the lining of the bladder wall, and it creates all of that irritation, basically, okay? So things that lead to interstitial cystitis from a Lyme disease standpoint could be the Lyme infection or could be Bartonella. Either one of those can do that. Now, what I have found in my practice is urologists can sometimes, when they look in the bladder with their cystoscopes, their flexible fiber optic cystoscopes, can sometimes see these inflammation changes, but not always. And if they don't see it, they won't diagnose the interstitial cystitis. But in situations where even they can't see it, I handle it like it still is interstitial cystitis, okay? So first of all, make sure that he doesn't have Lyme or Bartonella. And so even though I know you've said Lyme here, you need to talk with his doctors to make sure that they've ruled out the possibility of Bartonella here too. And if he does have Bartonella, he should be treated for that, okay? Number two, there are some herbs that you can take that will help with the bladder symptoms. And the two main ones are glucosamine sulfate, and the second one is quercetin. Okay, so glucosamine sulfate, you may be aware of, is something we use for people that have cartilage injury in the joints and osteoarthritis changes in joints, because it can be a building block for cartilage. But when you take it as a capsule, it's broken down, and in the bladder, it actually helps form kind of a gelatinous protective barrier to the lining of the bladder. Okay. The quercetin, which is an herb we historically have used to treat allergies and can also control inflammation cytokines, is very useful at decreasing the inflammation in the bladder lining. That's giving you all the symptoms too. So if you were to get those two herbs separately as quercetin, it comes as a 250 milligram pill. I like using a thorn product for that. And I have people take 2 of those 250 milligram pills 3 times a day. And I combine that with glucosamine sulfate. I use a thorn product for that. And I have people take 500 milligrams 3 times a day of that. Okay, so that's one option. All right, do them as 2 separate herbs. There also is a product made by a company called Vitanica, and you can find that at Marty Ross MD Supplements. And the product is called Bladder Ease. And Bladder Ease has in it glucosamine sulfate, something called L-arginine, and it's got some of the quercetin in it as well too. And if you were to do that product, you would want to take 4 pills 3 times a day. Okay, so you still have to take as many pills, but it's an all-in-one product as well too. Okay, and I would give those about 3 to 4 weeks, see if they're going to make a difference for his bladder symptoms. They work probably about 75% of the time. Okay, all right. Good luck, April. And, you should, again, talk these over with your Lyme physician as well, too, because I can't be your doctor here. But those are things I have tried in my practice that I have found helpful here. Okay. All right. All right, everyone. That's it for me for tonight. I don't have my Basinja to go walk tonight, but I'm actually having dinner with my niece who lives here in Kansas City. And we get to go out and hang out for a bit. She's my sister who lives in Fort Wayne, Indiana. It's her daughter. And look forward to seeing her tonight. So I got to go meet her. She's driving Uncle Marty around Kansas City. I get to go hang out where the 20-year-olds do. This should be interesting, but I look forward to it tonight. So it was good being here with you, everyone. And we will have another webinar series beginning next week, actually. We'll begin the December series. We'll do 3 in a row. In tomorrow's email that you get from me announcing that the recording is ready to be seen for tonight, I will also have an opportunity for you there to sign up for the next series of webinars. And again, I'll make my request again, share my information widely and share the emails that you get from me widely. Let people know what's going on here so they can get some benefit as well too. Help me to reach as many people as possible. Okay. All right. Good night, everyone. Thanks for being here.